Hello, my name is Anne Grattage. I'm one of the women's health physiotherapists working at Singleton Hospital. The video clips are about abdominal breathing, relaxed breathing, doing these breathing techniques in either a sitting position or a supine lying position. The abdominal breathing clip tells you why we breathe abdominally, and once you master this, it's a really good way to learn to relax, hence relaxed breathing. The reason being is that if you breathe abdominally, it's the most efficient type of breathing that we can do, but it also allows you to relax other muscles in the body, and therefore for pain relief, if you can switch other muscles off, it is great to help with that way of relieving pain. But it's also really good for relaxation because you can tune into the breath, you can slow the breath down, your body is relaxed, and you can just switch off from the environment, things around you, distractions in your head. So we're going to give it a go. Before you watch the videos, it's best probably to put on some comfortable clothing and find a quiet place that you can concentrate on the videos and also concentrate on relaxing. You may not master this breathing technique immediately, but it's good to watch the clips first, then have a go in the sitting or lying position you've chosen and join in with the video. Each time you try, you'll probably find it easier, and the best thing is just enjoy it and try this new technique with no preconceptions of what's going to happen. And the more you try, the better you'll get and the more relaxation you will get from doing these. I hope you enjoy the video clips. Thank you. Hi, I'm going to talk about diaphragmatic or abdominal breathing, relaxed breathing technique. This conscious breathing has been around for centuries, used in yoga and the martial arts. Nowadays, a lot of us breathe in our chest, shoulders and necks, which is a shallow rapid breathing learnt by a stress response, which would have been for fight, flight, running away from a predator who's going to attack us, or fighting our enemy. When you breathe diaphragmatically, you're slowing your breath down and telling the body that actually you can take your time to breathe and relax. And this breathing allows you to reduce stress, anxiety, pain management, along with a whole host of other benefits from this breathing technique. The diaphragm is at the base of the lungs and it's a dome-shaped muscle. And when it contracts, it actually flattens, drawing the lungs down and filling them with air. Now this flattening action of the diaphragm actually pushes down onto the abdomen, and when you have your abdomen relaxed, your tummy relaxed, it allows that tummy to expand. When the diaphragm then relaxes back to its dome-shaped resting position, the tummy just passively moves back down towards the spine. This relaxed breathing technique focuses in on movement, the expansion and relaxation of that tummy, and allows you to focus in on your breathing and slow your breath down and relax. We're doing this in a seated position, so it's important that you find a chair that you can sit comfortably in. We need our feet to be able to be flat on the floor, our pelvis at the back of the chair, and be able to be supported with our spine by the back of the chair. Our feet need to be hip-width apart just to make us in a neutral position. We're going to rock over our pelvis, so we want to have the tip of our pelvis in contact with the chair, then roll through that pelvis to find the lumbar spine pushing back into that chair, flattening your back into that chair, rolling over that pelvis again just to find the front of your pelvis, then roll over that pelvis to flatten your back into the chair. And now just let yourself sink into that pelvis, letting it come forward slightly so that you can feel two bony prominences, your sit bones, sinking into that chair. So our weight is transferring down into the chair through those two bony prominences, the sit bones in our pelvis. Make sure that your back is supported by that chair and you can relax your back as much as possible into the chair and be as comfortable as you can in this seated position. We're going to relax our shoulders and also our neck and our jaw and our heads, so that when we do this breathing technique, we're going to be breathing abdominally, and the chest, shoulders and everywhere else is going to be as still as we can. And if you're just learning this technique, sometimes it might be worth putting your chair in front of a mirror so that you can see that you can keep your shoulders and your chest still and breathe more into your abdomen here. So we're going to circle our shoulders up to our ears, squeeze them around our spines and drop them away. Give them a wiggle. And try that again. Circle up to our ears, squeeze them around our spines, drop them down. Imagine they're pulling down into back pockets, and just try and relax into that position there. We're just going to relax our neck, so we're just going to look over our left shoulder and turn to look over our left shoulder. Come back to the centre and turn to look over our right shoulder. Come back to the centre, take our chin down to our chest, and then lead with the chin up towards the ceiling. And bring that chin back to neutral, and just make sure our head's in a nice little central spot, as relaxed as possible. Finally, we want to have our jaw relaxed and a gap between our back teeth, so that we're not holding any tension in our jaw, which is quite a common thing to do. So we're going to wiggle our jaws side to side in a circle, and then the other way. So wiggle the jaw, circle, wiggle again, circle the other way. Okay, nice big swallow to prepare. So we're sitting feet hip width apart. Pelvis is at the back of the chair. We've got our weight sinking down through those sit bones into the chair. Our back is nice and supported and comfortable. Our shoulders are relaxed and away from our ears. Our head is relaxed, our neck is relaxed, and our jaw is relaxed. Our arms want to be nice and heavy from those shoulders, and we're just resting our hands very gently on our tummies. As we start to do the breathing technique, we're going to breathe in and out through our noses. This helps us to focus in on our breathing and focus away from anything else that might be distracting us. External environmental noises, thoughts in our heads, the adverse situation we're in at the moment. We're going to let go of all of that and completely tune into ourselves and our breath. And breathing in and out through our nose helps us do this. Focusing on our hands moving with the breath as we expand and deflate also helps with this. So we're going to try 3 breaths now, and then we're going to have a rest. So hands gently on your tummies. I'm going to exaggerate the movement of this hand moving in and out, but that's what you should feel if you're doing the breathing well. And if you're not, don't start getting stressed or worried about the breathing technique. Just keep practicing, and the more you practice, the more it will come and be an easier technique to do, and then the more you can relax while you're doing it. So we're going to breathe through our nose. We're going to inhale, inhaling now. Pause at the top and exhale through your nose. Pausing there. Inhaling through our noses. Feeling that tummy moving and expanding. And exhale through your nose. Feeling that tummy sinking back down. One more time, inhaling. And exhaling. Okay, so that's the way that we're going to do the breathing. The next thing we're going to do is think about trying to do that with our eyes closed. We don't have to close our eyes, but again, if you can switch away from anything else externally and just internally focus into your tummy moving, the breath moving in and out that you can hear, and tune into the breath and relax, the better it is and the more relaxed you feel at the end of it. We're going to do 5 breaths like this, remembering our feet are flat on the floor, hip width apart. Our weight is sinking down through those sit bones. Our shoulders are down and relaxed. Our jaw is relaxed. And we're just breathing in and out through our noses. So we're going to blink our eyes closed. Allow your tongue to feel heavy in your mouth, that gap between your back teeth. Just bring your thoughts into your breath and let them go. And if you're feeling any aches or pains, just every time you exhale, see if you can breathe them away. So we're going to inhale through our noses, inhaling. Pause here and exhale. Inhaling. Pause and exhale. Inhaling through that nose, feeling that tummy expand. Tummy sink into the spine as you exhale. Let's do two more. Inhaling and exhaling. One last time, inhaling through that nose. And exhale. And slowly blink our eyes open. Welcome back into the room. We have a seagull in the background making lots of noise. That's the relaxed breathing technique. You can practice this for as long as you like, 5 minutes, 10 minutes, just a few breaths like we've just done. And when you feel that you've got that nice and relaxed and you're doing it well, if you don't force the breath, then you find that you don't get dizzy or feel strange with it. So just the more you relax, the easier breath will come and the longer you can do it for. So if you feel that you're ready to move on or want to move on to something else, the next clip will show you how to incorporate the pelvic floor into that breathing technique. And we will do breathing along with contracting and relaxing the pelvic floor. This video slide is going to demonstrate relaxed breathing in a supine lying position on our backs. It's probably best if you can to have your feet flat on the bed or the floor and your knees bent up so that you can have the small of your back in contact with the floor so that it's relaxed. We're going to rest our hands gently on our tummies, and this is so that we can feel the inflation rising of our tummy as we inhale and the deflation, tummy sinking towards the spine as we exhale. We want to keep our chest and shoulders still, and we're breathing just from our abdominal area. Before we start, we're just going to tilt our pelvis into the bed, so really pushing that small of your back into the bed, and then tilt the pelvis away from the bed so that we can fit our hand in under our back. And now just bring that pelvis back down and relax in a neutral spine. So just trying to keep that spine not tilted right back so that we can't feel our hand there, not so far that we've got a gap there, but just resting gently on the bed so that the sacrum area at the base of our spine is in contact with the bed. We're going to inhale through our nose and exhale through our nose. As we inhale, we'll feel our tummy rising as the tummy expands, and as we exhale, we'll feel that tummy sinking back down towards the spine. So we're going to inhale through our nose now, inhaling. Pause at the top and exhale. Pause at the end. Slowly inhale. And slowly exhale. If you're not aware of your tummy moving very much, just keep practicing and it will get easier. When you've mastered the relaxed breathing technique, You can then think about doing this with your eyes closed if you choose to, just to allow yourself to relax even more. So we're just going to do a few breaths with our eyes closed, just to demonstrate doing this, and then you can continue with this for 5, 10, 20 minutes or as many breaths as you like as you practice this further. So we're going to blink our eyes closed, inhale through our noses, allowing that tummy to rise, pausing at the end, and exhaling, allowing that tummy to sink back down to the spine. Inhaling, pausing at the end of that breath, and exhale, allowing the tummy to sink back down. I'll demonstrate this with you one last time. Inhaling, pause, and exhale, pausing at the end. As you become more competent at this breathing, you can increase the length of time that you're breathing in and out for as it suits you. You can continue breathing with your eyes closed now, or you can blink them open and finish your breathing here until you're ready to do it the next time. So I'm going to blink my eyes open, and that's the end of the slide. Thank you.